Dave Coulier, known for his role in the beloved sitcom Full House, recently opened up about the profound support he received from his wife, Melissa, during his battle with cancer. At 65 years old, Coulier is not only celebrating the joy of becoming a grandfather, but also triumphing over stage 3 non-Hodgkin lymphoma, a serious form of blood cancer. His journey through treatment was marked by challenges, but it was the unwavering love and dedication of his wife that provided him with the strength to persevere. Coulier expressed his deep appreciation for Melissa, who took on the demanding role of caregiver as he navigated the complexities of his diagnosis and treatment. What really stood out to me was how remarkable she was throughout this entire journey, he shared in an interview with WJBK News. Diagnosed in November 2024, Coulier was no stranger to the harsh realities of cancer, having witnessed his mother and sisters face their own battles with the disease. However, this time, he gained a new perspective on the emotional burden that cancer places not only on the patient, but also on their loved ones. I realized that the impact on her was significant, and sometimes it can be even more challenging for those around you than for yourself, he reflected. You're trying to push through while they are experiencing their own journey alongside you, albeit in a different way. Melissa, a fitness instructor and wellness advocate, stepped into the caregiver role with grace and determination. This is a position that many spouses find themselves in when cancer enters their lives. From coordinating medical appointments to providing emotional support during chemotherapy sessions, she was a constant presence by Coulier's side. She was there for me around the clock, attending every chemotherapy session, which meant hours of sitting in the treatment room and driving me to various doctor appointments. He recounted, "She ensured I was eating well and even organized my medications in a labeled pill case. Her support went beyond mere logistics. It was a blend of emotional, physical, and personal care. Whether it was soothing his aching legs during painful cramps or helping him maintain a structured schedule, Melissa's involvement was nothing short of a lifeline." This narrative highlights the often overlooked reality of caregiving, which encompasses quiet strength, emotional labor, and the fierce compassion that partners exhibit in the fight against cancer. Caregivers like Melissa are the unsung heroes behind every survivor's story, playing a crucial role in navigating treatment decisions and providing daily support. For those stepping into the caregiver role, it's essential to recognize the importance of self-care. Caregivers often face their own challenges, and resources are available to help them manage their well-being while supporting their loved ones. Here are some helpful resources. A Sacred and Blessed Calling, Managing Life as a Caregiver. Be Proud of What You're Doing, Justine Almada's tribute to cancer caregivers. Caregivers can't provide optimal care for their loved ones with cancer if they don't care for themselves. Being the support they need. Tips for taking on the role of caregiver as a spouse or partner faces cancer. Top tips for cancer caregivers to help them through the process. How embracing the role of cancer caregiver brought Iowa couple closer, strengthened their marriage. When a partner receives a cancer diagnosis, it can feel like a tidal wave crashing down, bringing with it a mix of grief, fear, and uncertainty. However, this challenging experience can also lead to deeper connections and newfound strength within the relationship. Couples who face cancer together often discover layers of resilience and tenderness that they may not have realized existed. To foster emotional stability during this tumultuous time, couples can take intentional steps, seek therapy to process feelings, create a safe space for open and honest conversations, educate themselves about the diagnosis and treatment together, join support groups to share experiences and learn from others. The role of a caregiver is not just about practical assistance. It is a deeply personal commitment. Whether you are a partner, sibling, parent, friend, or even a child, stepping into this role means providing both emotional and logistical support. Caregivers often become a steady presence throughout treatment, appointments, and daily life. Typical responsibilities of caregivers include attending medical appointments and asking important questions, providing transportation and companionship during treatments, monitoring symptoms, and communicating with healthcare teams, connecting with social workers and patient navigators, helping manage daily routines, and offering reassurance during tough moments. While caregivers are vital to the cancer journey, it's crucial that they also prioritize their own well-being. Mental health support, financial guidance, and peer resources are essential for caregivers to remain strong for both their loved ones and themselves. Coulier's journey with non-Hodgkin lymphoma began when he was diagnosed in early November 2024. His rise to fame came from his role on Full House, a sitcom that aired from 1987 to 1995, featuring a cast that included the late Bob Saget, John Stamos, and the Olsen twins. The show revolved around a widowed sportscaster raising his 3 daughters with the help of his brother-in-law and best friend. Having witnessed the struggles of the women in his family who battled cancer, Coulier drew inspiration from their strength. "If I can be just a fraction as strong as they were, I know I'll be okay," he stated. Non-Hodgkin lymphoma is a broad category of blood cancers that originate in white blood cells known as lymphocytes, which are crucial to the immune system. Doctors classify these cancers based on the specific type of lymphocytes involved, B cells or T cells. Understanding the type of lymphoma is essential for determining the most effective treatment plan. Most non-Hodgkin lymphomas, approximately 85%, affect B cells, which are responsible for producing antibodies that combat infections. The growth rate and spread of lymphoma can vary significantly, with some types being more aggressive than others. Coulier underwent several months of chemotherapy, a common treatment for non-Hodgkin lymphoma, which resulted in hair loss, a side effect that can take a significant emotional toll on patients. Experts emphasize the importance of preparing for this change and finding coping strategies to maintain confidence during treatment. For cancer patients, losing one's hair can be incredibly stressful. The anticipation of this loss can lead to anxiety and sleepless nights. Noted Dr. Samantha Boardman, a psychiatrist. Hair loss typically begins a few weeks after treatment starts and can continue throughout the chemotherapy process as the treatment targets rapidly dividing cells, including both cancerous and healthy hair cells. To cope with hair loss, patients are encouraged to seek support from others who have faced similar challenges. Options such as wigs, hats, and head wraps can help maintain a sense of normalcy and comfort during treatment. Fatigue is another common side effect of chemotherapy, and Coulier experienced this firsthand. Dr. Zachary Reese, a medical oncologist, describes the fatigue pattern many patients encounter. Chemotherapy can feel like a roller coaster. You may feel exhausted about a week into treatment, and then you start to recover just in time for the next cycle. While fatigue varies from person to person, it typically lasts for about a week after treatment, depending on the number of cycles completed. However, patients can take proactive steps to manage their energy levels and support their recovery. Some effective strategies for coping with fatigue include eating a balanced diet rich in fruits, vegetables, and whole grains to maintain energy, prioritizing quality sleep by establishing a consistent sleep routine, engaging in light physical activity, which can boost energy and improve overall well-being. Dr. Reese encourages patients to stay active, even if it means starting with small increments of exercise. This doesn't mean you need to run a marathon, but even 30 minutes of activity each day can make a significant difference, he advises. If 30 minutes feels daunting, starting with just 10 minutes and gradually increasing activity can be beneficial. The key is to choose enjoyable activities, whether it's walking, swimming, or practicing yoga, to make movement feel like a form of self-care rather than a chore. While the journey through chemotherapy can be challenging, maintaining a balanced routine can help patients manage their energy levels and navigate their treatment with greater resilience. When it comes to treating lymphoma, the approach varies based on the specific type and stage of the disease. Dr. Lawrence Pirro, an expert in the field, explains that some lymphomas are treatable but not curable. Non-Hodgkin lymphoma is more likely to spread randomly and can be found in various lymph nodes throughout the body, while Hodgkin lymphoma tends to grow in a more predictable manner. For aggressive non-Hodgkin lymphoma, patients may receive a combination chemotherapy regimen known as R-CHOP, which includes several drugs designed to target the cancer effectively. R-CHOP consists of rituximab, Rituxan, a monoclonal antibody that targets cancerous B cells, cyclophosphamide, a chemotherapy agent, doxorubicin hydrochloride, another chemotherapy drug, vincristine sulfate, a chemotherapy medication, prednisone, a steroid that helps reduce inflammation. Patients typically undergo 6 cycles of R-CHOP, spaced 3 weeks apart, to maximize the treatment's effectiveness. In conclusion, Dave Coulier's story is a powerful reminder of the strength found in love and support during the most challenging times. His journey through cancer, alongside the unwavering dedication of his wife Melissa, sheds light on the vital role caregivers play in the healing process. As we reflect on their experience, it raises important questions about the nature of caregiving and the emotional toll it takes on both patients and their loved ones. What are your thoughts on the caregiver's role in cancer treatment? Have you or someone you know experienced a similar journey? We invite you to share your insights and experiences in the comments.